Hello, I'm Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about cone biopsy or LEEP. This is just some general preoperative and postoperative information. A LEEP or cone biopsy generally is a procedure used to treat cervical dysplasia, which is not cervix cancer but precancer of the cervix. There are some exceptions, but that's the main reason. This can be done in the surgery center, in the operating room, or sometimes in the office as well. You have to talk and see with your physician what the plan is for your particular case. It's a pretty easy surgery, very low chance of any complications. All surgeries have a risk of bleeding, infection, anesthesia, injury to adjacent organs, and others, but the risks are pretty darn low about this. There might even be a very rare risk, I've never seen it happen and done this procedure many times, of so much bleeding that you might even need an extensive surgery or even a hysterectomy to stop the bleeding. Again, super rare, and you need to talk to your physician if you're at higher risk for that. If you have an increased risk for infection, then you'll speak with your physicians about reducing those risks. Like if you're a smoker, it's good to avoid smoking a few weeks before and after the surgery. If you have diabetes, you certainly want to get your sugars optimized. Your hemoglobin A1C is the blood level. You want that lower. In fact, at our hospital, we can't do an elective procedure like that if your blood level isn't below, your A1C isn't below 8, for example. These are some general guidelines. Again, ask your physician for your particular process. So the actual surgery itself can be as short as less than a minute. Very simple. Afterwards, you may have a little cramping, a little bit of bleeding. That bleeding might last a couple of days or a little longer. There'll be a restriction time, generally a couple of weeks, to avoid intercourse and avoiding some of the things you might do when you're on your period, like going swimming, taking a bath. Otherwise, you can resume virtually all normal activities soon after. Again, this is general, not for your particular case, so discuss that with your doctor. And generally, a few weeks after, 2 to 6 weeks after, you'll have a post-operative visit to go over your results. This is generally the result of the HPV virus, the human papillomavirus. You'll still need follow-up afterwards, more pap smears, so that's important to get as well. So this isn't every aspect of information that you need to know. I hope you found it useful and reassuring, and as a nice background for before the procedure and after, and then you can get some tailored information from your own physician. Thank you.